So child CPR is not too different from adult CPR. So we're going to spend the majority of this video focusing on those differences, but we also will go through the similarities just as a reminder for a little bit of extra repetition on CPR. Now, when we talk about a child for the purposes of CPR, we're talking about someone who's between the ages of 1 to puberty. If we see signs of puberty, we'll treat them as an adult. If we don't see signs of puberty, but they're at least 1 year old, we'll treat them as a child. Now, if they're up to age 1, we consider that to be an infant, and we'll talk about infants in the next video separately. So child CPR, at least age 1, not showing signs of puberty. If we see those signs of puberty, we would go back to the last video and treat them as an adult. Okay, so assessing the scene, you still want to make sure you have your personal protective equipment on. Kids carry all kinds of infectious diseases, pertussis and things like that we probably haven't been exposed to in quite a while, unless you work with pediatrics or you're a teacher or something like that. You probably are not exposed to those childhood illnesses as much. So you're probably even more prone to catching them from a child than something you might catch from an adult. So still make sure you have your gloves, make sure you have some sort of airway protection, either a pocket mask or a BVM. Now, if you're using a BVM, a bag valve mask, you want to make sure you're using the pediatric size BVM. They require less air, and it's way too easy to accidentally give the child too much air or overinflate their lungs if you try to use an adult BVM, because you'll really quickly give way too much air. If you don't have a pocket mask or a BVM, for the adult, I said go do hands only chest compressions. For the child, they really need the breaths a lot more than an adult. A child typically goes into cardiac arrest because they were first in respiratory arrest. So they're usually a lot more deprived of oxygen when we're doing CPR, and those breaths are a lot more important. So if you don't have a way to protect your airway, if there's, someone else on scene that is a caregiver for that child, or they know that child's medical history and they're willing to give the breaths, I would instruct them on how to give the breaths to the child. Just like the adult, you would have the person pinch their nose, tilt their head back, and seal their lips around the child's lips to give the breath. You really need to instruct them to be careful with the amount of air they're giving, because again, those child's lungs are going to be much smaller than their own lungs. So they need to be very careful that they only go just until they see chest rise, as we always do, but they're going to have to take extra caution when it's a child. Also, scene safety. Kids can still be in, dangerous situations, domestic violence disputes, school shootings, a fire, anything like that. It's just as important to make sure the scene is safe. I know it can be really tempting, even more so when it's a child, to go running into that dangerous situation thinking, I have to do something here. But remember, when you go running into a dangerous situation without the right training and, more importantly, the correct equipment, you become a second patient or a third patient or a fourth patient. And now when the resources show up to help those children, they're going to be spread even more thin because now they have to help you too. So I know it's tempting to risk it, but it's really not worth it. And even not even out of just selfishness, but out of, if the rescuers have to help you too, they're not going to be able to help the children as well as they would have been able to. So it's better for the children as well for you not to enter a dangerous situation without the right training and the right equipment. So call for those additional resources to make that scene safe. Okay, just like the adult, we're going to go through with the child and check for AVPU. Are they alert as we walk up? If not, we're going to check for that verbal stimulus. Hey, are you okay? If they don't respond, we're going to go for that painful stimulus. As I said earlier, I prefer that trap pinch. Same thing for the children. You can pinch that shoulder and see if they respond. If they don't, we're going to go ahead and check that carotid pulse and breathing, just like we did for the adult. No more than 10 seconds. We're checking both at the same time. Again, if they have a pulse and they're breathing, we'll just put them in the recovery position and transport. Or if they have a pulse but they're not breathing very well, we'll monitor and help with their airway by using the BVM or the non-rebreather or suctioning or whatever their airway needs. Just like the adult, be careful you don't get tricked by those agonal gasps. If their brain is just sending a signal, you'll see their stomach moving a lot, but you won't feel that air consistently coming in and out of the mouth and nose. Now, one thing that's different for children, when we check their pulse, If they have a pulse less than something, we're going to start CPR anyway. I'm asking it to you as a question first, so you can take a second to see if you know what that number is. The answer is 60. If they have a pulse less than 60, you'll start CPR anyways. The reasoning for this is because when adults basically go into shock and die, their hearts beat really, 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 really fast until they stop. You know, in the moments before death, an adult's pulse is in the 200s typically. A child is different. They start the same way. Their pulse beats really, 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 really fast, but then it doesn't just stop. It actually slows down to a stop. And the reason for this is because their heart stops beating, typically because of oxygen deprivation. So the heart is a muscle. Think of the heart as the same thing as like a bicep. It's obviously a little bit different, but we can use this as an example to understand what's going on. If somebody threw you a 10-pound weight and said, do bicep curls, and when you stop doing bicep curls, you die. Okay? You're doing the bicep curls as fast as you can. You're not just going to do 200 of them and then drop the weight instantly. You're going to do those curls. They're going to be really, really, really fast. Then they're going to get a little bit slower. And those last couple curls are going to be extremely slow with everything you have to do that curl. Now, I said a 10-pound weight. Some of you might be thinking, no, Danielle, I could do that forever. Okay, maybe you can. If that's the case, we'll say it's a 50-pound weight or a 100-pound weight. But regardless of whatever weight it takes to burn you out, at a certain point, those last couple bicep curls are going to be very slow. The same thing happens to a child's heart. It's going to beat hard and fast. And then it's going to get deprived of oxygen. It's going to keep working to try to keep them alive, but it's going to slow down. And when it gets down below 60, it's not enough blood flow to keep them conscious, and it's on its way to stopping. So they're not going to be conscious. They're not going to be responding to painful stimulus or anything like that. Their heart's just barely beating, and it's not circulating enough blood to support life. And it's also about to stop anyway. So if they have a pulse less than 60, we're going to go ahead and jump in and start CPR right at that moment. Chest compressions for the child, they need to be on a firm surface. Your hands are going to be placed in the center of the chest, just like before, right between the nipple line. You're still going to lock your elbows and bend at the waist. For the depth, instead of at least 2 inches, we're now going to go about 2 inches. And I like the other way they describe this better. The other way they describe it is 1/3 the depth of the chest. So you're going to push down 1/3 of the way. That's a lot easier to judge. And it's also just seems more accurate because you could have an 18-month-old or you could have a 9-year-old, and they're all considered a child. So 1/3 the depth is going to be very different for those two children. So 1/3 the depth of the chest is the number that I like the best. Now, to accomplish that, you may use 2 hands to do the compressions, or you may use 1. That's going to depend on how big the child is and how big you are. You just have to make the best decision for what's going to help you accomplish 1/3 of the depth for the compression. We're going to see that in a video in just a second, so you can see what the 2 different ways look like. We also, just like the adult, want to get adequate chest recoil. We squeeze the blood out, but we also have to let the chest rise all the way back up to its natural position to let the heart refill with blood between each compression. And we always, always, always go at that same speed for chest compressions. That's between 100 and 120 compressions per minute. Yes, kids naturally have a faster heartbeat than adults, but 100 to 120 is just the fastest that we can go and still allow that heart to have time to refill with blood. So we just do the best we can. So let's have a look at this video.
Chest compressions on a child are very similar to those that you would give an adult. The difference being how deep we want to compress. We want to compress 1/3 the depth of the chest. So from my hand down to the floor, we want to push 1/3 of the way. Now to accomplish that, you can do the same thing as we did for the adults. Using 2 hands, tilt your wrist back, use the heel of your palm. Okay. However, if you find that to be too forceful and you're going greater than 1/3 the depth of the chest, you can switch and use 1 hand. So 1 hand in front on the middle of the chest. That may be enough depending on the size of the child and how big you are. If 1 hand is kind of working but you're losing balance, you can use your other hand to kind of grip your forearm to stay balanced.
Okay, for the breaths for the child, same thing as before. We need to open the airway. Usually we're going to use that head tilt chin lift, but if they had a possible spinal head, neck, or back injury, we are going to use the jaw thrust to open the airway. We still want to get a good seal with the mask. As before, if we have an extra person to hold the mask while one person squeezes the bag, that's ideal. We're still going to deliver the breath over the period of 1 second. As the child gets smaller and smaller and requires less and less air, this gets more and more challenging. It's really easy to squeeze way too fast on that 1 second. So you want to slow yourself down and squeeze that bag nice and slow. And just like before, we want to limit our time off the chest. We want to keep blood flow going to that heart, lungs, brain, all that stuff to keep them alive. Okay, putting this all together for a child, if you're by yourself, if one rescuer, if you're doing CPR alone on a child, you still do the same compression rate we did for adults, 30 compressions to 2 breaths. Now, it's a little bit different if we have 2 or more rescuers. We actually switch and we do 15 compressions to 2 breaths. So you might be wondering why this is. Well, 15 to 2 is ideal for kids. Why is that ideal for kids? They have a higher oxygen demand than adults. Remember, their bodies need more oxygen. They breathe faster than adults. Furthermore, often their cardiopulmonary arrest is caused by respiratory arrest first. It's more likely that it was an airway issue that caused the heart to stop. We don't usually see children having heart attacks. We usually see them having pneumonia, choking, RSV, bronchiolitis, all these things that cause problems with breathing, pertussis. And then secondary to that, their heart stops beating because they're not getting enough oxygen. They also, again, just need more oxygen. So 15 to 2 is ideal. So why only do that with 2 rescuers? If it's the best way, why not do it with 1 rescuer? Well, because those chest compressions are still really, really important. And if you have 1 rescuer and every 15 compressions, you have to stop compressions, get the mask, put it on the face, get a good seal, tilt the head back, squeeze, squeeze, put the mask down, get back to the chest, get in position, start your chest compressions. That's a really long gap in time. Remember before when we talked about 2 rescuer CPR, you're going to be really quick to change because the person on the chest compressions is going to stay hovering right over the chest. The person on breaths is going to keep that mask in place, keep that airway open with the head tilt chin lift the entire time. So when we have 2 or more rescuers, it's really quick to switch between compressions and breaths. So we'll briefly pause those compressions after 15, get the 2 breaths in, go right back to those 15 chest compressions. We still want to give that person doing chest compressions a break every 5 cycles so that they can stay at their maximum ability level to do those chest compressions effectively. Just like the adult, we're going to apply the AED as soon as we get it. As soon as you possibly can, you want to get that AED on the patient and ready to use. Now, just like we talked about with the adults, a child can also have an advanced airway placed by a paramedic or by a doctor. They would be intubated or an iGel or a King airway, some type of advanced airway. When we say advanced airway, we don't mean an OPA or an NPA. We mean an advanced airway, something that's actually going down into their trachea to force the air further down into their lungs. You'll know because you'll see again that tube coming out of their mouth. Just like before, our BVM, we take the mask off, it'll attach to the tube. Just like before, we'll go to continuous chest compressions. If you're the one doing chest compressions after that patient's intubated, you just keep going with your chest compressions and you do not stop. You may still count to 200 because that's going to be your 2-minute mark, and that's when you should swap out somebody new to do those chest compressions. One thing that's different for a child, and this is actually new as of January 2021, that's when they released the 2020 American Heart Association standards. They actually updated this. It's now the same for an advanced airway as it would be for rescue breathing for a child. We actually give that breath every 2 to 3 seconds. So the person doing chest compressions is not going to stop. The person giving breaths is going to count 1, 1,000, 2, 1,000, 3, 1,000 breath. 1, 1,000, 2, 1,000, 3, 1,000 breath. 1, 1,000, 2, 1,000, 3, 1,000 breath. And the compressions are just going to keep going. They're not going to stop. Again, kids have a higher oxygen demand. So that's why we're going to give them that breath every 2 to 3 seconds instead of every 5 to 6 seconds.